Hello, I'm Dr. David Katz. I'm an internist, a board-certified specialist in preventive medicine public health, and past president of the American College of Lifestyle Medicine. I've devoted my career to disease prevention, health promotion, adding years to life and life to years, and over the last decade and a half, focusing in particular on healthy, vital people on a healthy, vital planet, trying to blend efforts in public health and planetary health. I took care of patients for 30 years, founded and directed the Yale University Yale Griffin Prevention Research Center, where we studied ways of preventing chronic, in particular cardiometabolic diseases in adults and children. And our approach was translational, looking to take the knowledge we have about disease prevention and turn it into what we do. I have authored about 250 peer-reviewed publications, 19 books to date. I may have one or two left in me, but I'm not sure. And I'm honored and delighted to be one of the science advisors to the Institute for Healthy Living. Well, frankly, your diet is probably the single most potent means you have to address both your vitality and your longevity, because in the modern world today, diet quality measured objectively is the single leading predictor of both years in life and life in years, the single leading predictor of the risk of major chronic diseases and premature death from all causes. So when you get diet right, almost certainly it's going to contribute to your longevity. So then the question is, how do you get diet right? Michael Pollan, the science writer, famously got that down to a 7-word answer: eat food, not too much, mostly plants. What he meant by food was real food. In other words, not ultra-processed junk where food ought to be, but real food direct from nature, things we know and recognize, know where they came from. And in particular, vegetables, fruits, whole grains, beans, lentils, nuts, and seeds, and plain water when thirsty. That's the basic formula. I reached that same conclusion, not in 7 words, closer to 5,000, in a peer-reviewed paper I published in 2014 in Annual Review of Public Health, a commission paper. Can we say what diet is best for health? And my conclusion was yes, in terms of a basic theme, and that's the theme. Lots of vegetables, fruits, whole grains, beans, lentils, nuts, and seeds, and plain water when thirsty. If you get that basic formula right, anything else you do is probably okay. And if you don't get that basic formula right, it doesn't matter what you do, you're not going to have a healthy diet overall. And the evidence that this contributes directly to longevity, to years in life, and that it can do so across a range of variants on that basic theme, comes to us courtesy of the Blue Zones, discovered by National Geographic fellow Dan Buettner. Many of us, I think, are now familiar with the story. These are 5 places around the world: Ikaria, Greece; Sardinia, Italy; Okinawa, Japan; Loma Linda, California; and the Nicoya Peninsula in Costa Rica, where people routinely live to be 100 or more, don't tend to get chronic disease, and are all beneficiaries of the same basic lifestyle formula. Their diets are quite different, but they all adhere to that theme of real food, not too much, mostly plants, in some cases exclusively plants, but those diets are quite varied. Some of them are mixed diets that do include dairy or meat or fish or poultry or eggs. Some do, some don't, but the basic theme every time is lots of vegetables, fruits, whole grains, beans, lentils, nuts, and seeds. When Dan Buettner talks about the diets in the Blue Zones, the single thing he calls out is legumes, beans and lentils that unify them. So very clear evidence that when combined with other healthy lifestyle practices, that basic theme of healthy eating absolutely can address longevity. We know a lot about the mechanisms too: protection of cells, increasing the length of our telomeres, the caps at the ends of our chromosomes, influencing gene expression, and on it goes. I don't have time in this brief video to cover all of that, but we don't just know that healthy diet, healthy living produces the outcome we want: more years in life, more life in years. We know a lot about the intracellular mechanisms. And much the same is true for physical activity. So how can you make physical activity a routine part of your health promotion practices? Well, the good news there is that all movement is good movement. We used to think that certain types of exercise were especially important: intense physical activity, aerobic versus weightlifting. all of the recent evidence about physical activity and health, and again, when I talk about health, I think the real prize is vitality and longevity, a long, vital life. That's really the prize. Well, all forms of movement contribute to that. Yes, exercise contributes to that. Yes, aerobic activity contributes to that. But so does resistance training by building lean body mass, which enhances immune system function and balance and helps protect health in a wide variety of ways. And most of the studies that have looked at ways to get there from here have found that just getting up and moving throughout the day, doing routine activities, working around the house, working in the yard, gardening, adds up to a cumulative benefit, assuming you get 30 minutes or more of activity every day, that rivals going to the gym. I think the mistake lots of people make is thinking there's only one way to exercise. And the other mistake people tend to make is thinking, I went to the gym and exercised today, so now it's okay to sit for the rest of the day. It's not. The more movement you can fit into your day, the better. So the best formula would be, yes, by all means, go to the gym, work out, dance, run, jog, box, bike, swim, play tennis, whatever it is you love to do, do that. But then in addition to that, be active throughout the day every chance you get. And if you combine these two, if you make optimal use of both your feet and your fork, high quality diet, and routine physical activity, you've gone a long way toward the lifestyle formula that absolutely can add both years to your life and life to your years. And as I trust you know, there are many apps that patients can use to track their dietary intake. Probably the best known around the world is MyFitnessPal, but there are a number of others where you can enter all the foods you're eating every day and all the nutritional details are archived and aggregated. There are two potential values in that kind of tracking. The first is gaining clear knowledge of what your overall dietary status and quality are. That's important in the same way that knowing your blood pressure or your cholesterol or your weight would be important. It's a metric you can use to establish personal goals, to compare where you are to where you want to be, to think about the particular journey you need to make to reach a health goal. And obviously, for those of us in the health professions, we're accustomed to treating to goal, whether it's blood pressure or lipid panel or glycohemoglobin or any other marker of cardiometabolic health. The single leading predictor variable in the modern world for all-cause mortality and total chronic disease risk is diet quality measured objectively. So that's a really important cue to action for provider and patient alike. The difficulty with all of this, though, is that entering everything you eat, so tracking all of your food, tracking all of your calories to get a comprehensive assessment, is pretty tedious. So it's the very rare patient who's willing to do that for an extended period of time, and that's problematic. Imagine if we wanted information about blood pressure, but it took hours to do a blood pressure assessment. Well, chances are we wouldn't get it in too many people, or if it were painful or expensive, or if we couldn't get the answer right away. We took a blood pressure measurement, but then had to submit it to somebody who had to do some sort of analysis to generate the results. So all the different means we have for assessing dietary intake are problematic in that sense. You have to aggregate information over time. You have to record lots of things in real time. When it's inconvenient, you'd rather just be enjoying a meal. You have to write down everything you eat. You have to write down how much you eat. You have to be honest about all that. So an alternative would be quite helpful. And at this stage of my career, that's what I'm focused on. I invented a method to assess dietary intake, diet quality, nutrient intake levels, servings per day of all the different food groups, using a pattern recognition, image-based approach rather than detailed logging every day or recollection as in a food frequency questionnaire, 24-hour recall, that can provide comprehensive results in about 60 seconds. So it's a 60-second interaction with images to pick what is my current dietary pattern, this or that, which one's most like how I eat now. It's fun, it's easy, It's pretty effortless. Everybody's good at recognizing which picture looks more like foods they eat. So it's kind of like a game. And you play that game for about 60 seconds, maybe 2 minutes, maybe 3 at the most. And there's your answer. And that produces instantaneous results because all of the data are already stored there. That system is called Diet ID, and that system is incorporated in the comprehensive data capture of the Institute for Healthy Living. So then that becomes a metric you can follow, just like blood pressure, just like glycohemoglobin. Where were you at the start? What is your diet quality using the Healthy Eating Index 2020, which is embedded into Diet ID? So this is an objective measure of diet quality, robustly validated against all-cause mortality, against chronic disease risk. And then that becomes a metric that you track over time and you treat to goal. If someone's starting out at tier 5 on a 10 tier, so 5th decile of the 10 deciles of the Healthy Eating Index, and you want to get them to 8, 9, or 10, at any interval you deem appropriate, you can reassess their diet, see how far they've come. The other thing that's valuable about this, kind of like GPS, if we know exactly where any given patient is and exactly where they want to go, we can do something very different than behavior modification, which kind of sounds like you're broken, we're here to fix you. We can do behavioral navigation, which is much more empowering, just like GPS. GPS doesn't tell you where to go. You say, here I am, here's where I want to go, help me get there. And GPS does by giving you a personalized term list. If we know where someone's diet is in all its details right now and where it ought to be for their specific health objectives, well, then we can break that down into something very much like a turn list, a sequence of micro challenges, a sequence of incremental adjustments to the diet. So having that tracking along the way empowers the entire journey. And as a health professional, it gives you information down to the nutrient level to see what exactly needs to change. How many fewer grams of sugar a day? How many fewer milligrams of sodium per day? How many more milligrams of calcium per day to hit the specific targets that I think are optimal for this patient? We can capture information that detailed at any interval we like, so it's empowering to patient and provider alike.